Craig Broussard, a pulmonologist here at Lake Charles Memorial Hospital. I practiced in Lake Charles for 30 years and I have 3 wonderful partners who I practice with. The 4 of us combined have approximately 100 years of experience in the pulmonary and critical care arena. That has brought us great comfort in taking care of these very, very sick patients with COVID-19. We are seeing a decrease in the number of ventilator days on our COVID patients. We've successfully extubated several patients, and some of our patients are nearing leaving the hospital period. We're seeing that these patients develop very thick secretions, requiring us to change out their endotracheal tubes. We're seeing neuromuscular damage that causes them to be very weak while on the mechanical ventilator. We're seeing secondary infections that cause them to be sick and have continued inflammatory markers in their body. These are all things that are not common to any of the disease processes that we've seen in the past. So it is very difficult treating these patients and getting them better. We're seeing our average length of stay on mechanical ventilation anywhere from 10 to 21 days, which is a very long process. We've been very fortunate to have an excellent nursing staff, excellent housekeeping personnel, excellent maintenance people. Our administration has given us everything we need to take care of these patients, and I think that's why we've been fairly successful with these patients. In the community, we're doing an excellent job. That's why we're seeing low numbers, but we need to keep doing this excellent job. This disease is like a loaded gun. If you come into contact with it, it can cause significant injury to your family. And that's why what we've seen work will continue to work if we continue to try the measures that everyone has told us to do. Social distancing, wearing masks if we have to go out in public, wiping down our surfaces, washing our hands frequently. All those things are helping this community keep this under control. We've used some of the drugs that have been talked about in the media. What we're seeing is it's difficult to tell whether or not we're seeing marked improvement. I think what's going to come out of these tests that the federal government is doing is that these drugs may help, but they have to be used at the very early part of the illness. By the time patients come in and have significant symptoms, I'm not sure they're making a big difference. They're medications that help with inflammatory response, and these patients' inflammatory responses are off the chart. So I'm not sure that unless these are administered early, that they give us a significant amount of help. You know, there are other tests going on, and hopefully we can learn from these tests. Just like we're learning from taking care of these patients what to expect, and then the next patient that comes in, we know more about what to expect in terms of taking care of them and what it's going to take care of them. Because there's nothing in a textbook about how this illness goes. We're learning as we go, and because of the experience we have, we're able to adapt to some of the changes that we're seeing. Initially, we thought if we can put these people on mechanical ventilation early in their course, we can protect everyone around them from the splatter of virus. But putting people on a mechanical ventilator is fraught with many complications and problems. So we would also like to keep them off of mechanical ventilation as long as we can, because we do know that once they go on mechanical ventilation, they're liable to be there for 10 to 21 days, which is difficult for anyone, even a healthy young person, to make it through. So we're using all of our experience to try and make the best decisions for these patients. And I think with the group of people we have here, the staff we have here, we've been very successful so far. We're very encouraged by the numbers we're seeing, and that's a credit to the fact of how well this community adapts to significant stresses like this. We saw it with Hurricane Rita, and we're seeing it now. This community knows how to react, knows how to take the information they're given and put it to good use, and help each other in the process.